In Health News today, we're talking about the purpose of cartilage in joints with chronic pain.
And we're talking about it with Dr. Jackson Drager of Midwest Pain Solutions. Good morning.
Good morning. Thanks for having me on.
Let's start with that basic lesson of what is cartilage.
Cartilage is a cushion between bones. So it allows for proper cushioning, and it also produces a fluid that, well, it works for seamless gliding, synovial fluid.
Okay, so which joints have cartilage?
Which joints have cartilage? Anywhere where two bones come together. So there's 206 bones in the body, and but there's 360 joints in the entire body. So
so all of them have the cartilage.
all
That's
of them
a lot
have the cartilage.
Okay, so are there joints that are more susceptible to chronic pain?
Yes, when it comes to chronic pain, it's usually, I always think of, it can be all 360 or more likely the heavy use joints, the knees, the hips, the low back, shoulders, everything.
Let's talk about some of the main reasons that we might experience joint pain.
Well, usually it's from overuse over the years. So a lot of repetitive injuries to the same area over and over and over again. That, or it could be one big injury, right? Like a car accident or surgery or a fall that you might have had.
How do we avoid degeneration of cartilage in our joints?
Well, that one's a little bit more simple. I always think of proper diet and exercise. That's always the best place to
I
start.
feel like that's the answer to a lot of things.
Exactly. So let's talk a little bit about what we do if we're already experiencing chronic pain, but with very little joint with cartilage.
So if you already have little cartilage and you've already had all of the repercussions of a long life, hard-lived, then that's where I step in at Midwest Pain Solutions. So we have a state-of-the-art high-intensity laser that can penetrate deep enough to get to the cartilage that is currently being damaged and worn away little by little, and then we want to reverse those effects.
So talk about what the laser actually does.
So what it does is it stimulates the healing that can happen inside damaged tissue.
Okay.
But the problem with damaged tissue is that once it's gone, it's gone. You can't get cartilage back. It's one of the very few tissues that happens to.
So the sooner we see you about this, the better, right?
Always the sooner the better.
With everything, yeah.
Yeah, all of my patients say that. I should have came in 5 years ago.
Yeah. Let's talk about what a session is like. What does it feel like to get the laser treatment?
Well, the high-intensity laser is just amplified light, because that's the stimulation of the radiation coming from that light. What it does is it feels like a little bit of soft heat, nothing more. It's pretty gentle.
Okay.
So you'll have a free consultation with patients because there's ideal candidates and people who maybe need a different solution, right?
Oh, yeah. If there's absolutely no cartilage left, then it's time to get that joint replaced. But if there's a sliver left, something that still can produce that fluid for the motion, then we can help.
Okay, well, you will want to get in for that free consultation. Get in touch with Midwest Pain Solutions. They are located on Cormier Road in Green Bay.
You can give them a call. It's a 920 number, 569-2350, or online, MidwestPainSolutions.com.
Thanks.